So today we are on the 153rd edition of Crisis Jam, which is a lot of episodes. I'm just so proud of this community of practice and what we've been able to do and the amount of content we've been able to put out, amount of topics we've been able to cover. And I'm super, super excited that today we will be hearing a little bit from the Youth Power Project and from their founder, Saanvi Arora, who is currently a sophomore at Berkeley, right across the pond from me in the Bay Area. I feel obligated to say go trees because I'm calling in from Stanford, but Berkeley won big time at the big game, so I'll give you guys that. And Saanvi really started an incredible community that bridges the generational gap in public policy by empowering youth under 25 to write local, state, and federal level legislation and policies. And, you know, on the prep session for this call, one of the things that we were talking about is how the Biden administration's cabinet is the most diverse in American history. But one key demographic that they are missing in federal government representation is young people, is youth, exactly that demographic of people under 25. I am very, very proud to say that federal mental health legislation and federal mental health advisory boards are breaking this gap. I'm very proud to be officially the youngest federal government appointee as a member of the SAMHSA National Advisory Committee. I have another incredible young person on that with me. Her name is Cynthia Yu. I encourage everybody to look up her work. But we know there's only two of us under 25 on that board. And there's a lot of work to be done, but I'm very proud to say that as a mental health community, as mental health advocates and those seeking mental health justice, we are starting to break that barrier. But that absolutely does not mean that the work is not done. And Saanvi is absolutely one of these people that is creating by youth and for youth projects to continue to break the cycle, not just in mental health, but in all forms of policy and all important issues that are relevant to young people. Because at the end of the day, as our NAMI tagline goes, there should be nothing about us without us. And it's super important for our voices to be directly included in the policy that affects us in our daily lives. So super excited to have her on the call today and super excited to hear from her. Just another quick talking point to go over on our Crisis Jam website. If you're here, you're seeing me live, you're registered. But for those of you watching later on through the YouTube link, this is what our website looks like. You need to click on that registration link that you see right there in order to be able to join our Zoom calls live. So yeah, just quick important reminder to keep in mind. And here is the actual words that you should type in to find our website, talk.crisisnow.com. Here are just a couple other highlights from that website. This was last week's episode about crisis services for Indigenous communities. Definitely recommend that everybody check that episode out, watch some previous episodes. There are really some incredible topics that we have been discussing recently. So yeah, definitely important to keep in mind as you move forward with your crisis care work. Here are just a couple more highlights of some episodes that got quite a few views. Our #1 most viewed episode is the special youth edition with Dr. Anita Everett and Dr. Belina Shaw, really reaching some very high numbers here. But here are just a couple other topics that we've touched on just to give everybody a little bit of a feel of what we've been doing here at Crisis Jam. So we've been talking about tech, we've been talking about receiving centers, about specific care. We had a special live episode with Dr. Miriam Delphin-Rittman. And some other topics that we've been discussing is a lot about the role of crisis response professionals in mental health care. So that includes EMS and 911. It includes police and law enforcement and what their limitations should be within crisis care. We talk about queer populations and about threat assessment and response. So these are just our number 10 most viewed episodes, but that's kind of a pretty good representation of some of the things we've been talking about. A new kind of like additional element that we've been adding to our Crisis Jam sessions has been debates about topics that have been like hot seat button topics in the crisis care community. So the first one that we did a few weeks ago was about, should AI be the future of crisis care? And we had Dr. Dave Atkins and Dr. John Draper featured on that. And some potential topics that are kind of in the rotation that we may discuss in the future include whether or not mental health should come in a police car, whether we should call it emergency instead of crisis care, and what the implications are of those words and kind of what is the charged meaning behind them and what the effect would be. We're going to talk about emergency crisis centers and whether it should employ peer specialists. And then this topic is very near and dear to my heart, and one that I suggested about whether social media companies should be held accountable for its impact on youth, and specifically the youth mental health crisis and a lot of individual crises that we're seeing. How can we hold social media companies accountable? You can probably just guess my bias based on the way that I'm presenting this. I've done a lot of work in the legislative space around holding social media companies accountable for harming youth. But there really is a debate to be had there. And yeah, just to kind of provide some numbers, we've had about 400 unique speakers speak on Crisis Jam, which I just think is incredible in considering how large of a community we have, and just how many diverse perspectives we've been able to incorporate into our sessions. But the work is not nearly done. As I've been saying, there are so many more perspectives that have been left off the table historically that we need to continue to include. And I'm very happy to be part of the effort to work towards that. So I'm now going to be moving to mental health in the news. One of the first items that we're going to be talking about is about Rosalynn Carter's passing, the former First Lady. She did some incredible work in the mental health care space and really set the tone for future First Ladies to come to be active in mental health advocacy, which includes Michelle Obama and Jill Biden, who I had the pleasure of meeting. Before Rosalynn Carter, First Ladies, really, this wasn't a topic that they covered. It was a bit more stigmatized, but she was very much an active member in kind of moving forward some very important mental health legislation, including the Mental Health Services Act, which set the tone for a mental health public service infrastructure to be set up in the United States. And she was the active honorary chair of the President's Mental Health Commission. So we are really sad about her passing, and we feel, her presence continues to be felt in the mental health advocacy community, and her work really guides a lot of what we're doing here. Another mental health news item that I think is super exciting. Tomorrow, 988 Canada will launch. Canada also uses the same 911 number as we do. And this is just a super exciting advancement for them. And just for the expansion of 988 and of on-demand crisis care, and really having a 911 for mental health, as we call it. All of these news items are actively being linked in the chat right now, so feel free to check those out to read up a little bit more about them. Important to kind of keep current events in mind as you continue with your mental health advocacy work. Another news item that we wanted to feature today is this article from the New York Times about violence, and specifically the story that is featured here is about how a lot of times the infrastructure that we have for unhoused individuals in this country fails to take into account their specific mental health needs, which contributes to this vicious cycle of lack of mental health care contributing to our unhoused crisis. So super exciting read, and just super, or exciting is definitely the wrong word, but like this is definitely a breakthrough in reporting about mental health and crisis care and unhoused care, is kind of continuing to explicitly link the three kind of as this triangle. And yeah, they are absolutely inextricable from each other, and it is very important to continue to uplift the voices of the unhoused community as we direct our mental health care towards those who need it. Also just wanted to remind everyone that we have a merchandise store. That feels like a bit of an awkward transition from a very heavy topic to a bit of a more light one, but nevertheless, it's very important that we get the word about 988 out there, because that's how we're going to get people's lives to be saved ultimately. So the link to that is right there on the slide. It's samhsa.gov/find-help/partners/988. We also have our own set of merch from our 988 Crisis Jam sessions. So feel free to go check those out. We have short sleeve, we have long sleeve. We have some clothes for everybody. We also have different logo variations. So feel free to check those out as well. We are now going to be moving on to our crisis trivia hot seat, which is a really fun little segment that we do here at 988 just to kind of learn a little bit more about mental health trivia. And I'm super, super excited to introduce today's guests in that. I'm going to be introducing Yolanda Cruz. who does some incredible work around disability advocacy and crisis intervention teams, or CIT, which are community partnerships within crisis care. And she translated the best practices guides into Spanish, which led to some outreach from Spain in learning more about CIT. So as a member of the disabled community in Northern California who comes from Spanish-speaking parents, I so appreciate your work, and I'm so excited to welcome you to Crisis Jam.
Thank you so much. I just want to clarify, I did not translate it, but I did I did facilitate the translation of the guide using 3 self-advocates with cerebral palsy. So they're all trained translators. So we were able to use them and they were able to get paid. So that's like an awesome thing to be able to do as well. A little bit about me, I'm Yolanda Cruz. I want to say first and foremost, I am a sibling to a brother with developmental disabilities, fetal alcohol syndrome, and also schizophrenia. So I've been, personally involved with a lot of crisis calls because of him, and I've learned so much. And because of that, I'm very passionate about sharing, what we as a family have experienced, and what we've done to ensure that those crisis calls are as positive as possible.
Thank you so much for sharing. And that's super exciting about being able to kind of close that gap and directly get those with firsthand experiences to be doing that work. So super important. So today's crisis care trivia question will set around the Surgeon General's report on our epidemic on loneliness and isolation. Surgeon General Vivek Murthy has absolutely been instrumental in producing information about mental health. And I recommend everybody read all of his advisories. I want to especially shout out the one on social media because that's a topic near and dear to my heart. But today's question will center around his newest report about loneliness and isolation. So the question that we have today is, in May of 2023, the Office of the U.S. Surgeon General released a public health advisory titled Our Epidemic on Loneliness and Isolation, the Healing Effects of Connection and Community. Which of the following is a vital component of social connection according to Holt-Lunstad? And this is something that is directly cited in that advisory. And you're welcome to phone a friend. If you aren't sure about the answer, you're welcome to just go ahead and attempt to answer that right now.
I think it's all of the above.
You are correct. You got it. Yeah, all of these are very important components of our social connection. Most of the audience got that right as well. Congratulations, everybody. You know your stuff. I definitely encourage everybody to go back and actually read through that full report or read through sections of it that interest you. But that's kind of the structure right there. Okay, and now we're going to be moving on to our video quote segment, which is from Moving America's Soul on Suicide, a documentary that I also recommend that everybody watch.
But we're social creatures and we couldn't survive ancestrally.
We're just replaying it right there, but this is Dr. Thomas Joyner, who is a leading suicide expert at Florida State University.
But we're social creatures and we couldn't survive ancestrally without each other. That's incidentally why we're so sensitive to feeling left out and feeling like we don't belong. In the ancestral environment, if that happened to you, it was death. It meant death.
Super moving and important quote. I recommend everybody click on the link in the chat to kind of watch a little bit more about that documentary, but just super important reminder about our innate need for connection and working towards decolonizing our mental health, talking about how that's been taken away from us. Okay, so I'm now going to reintroduce Saanvi, who I talked a little bit about in the beginning, but she's my incredible friend and colleague in the mental health advocacy space, and she's going to be talking a little bit about the Youth Power Project, kind of getting into the nitty-gritty of what it does and how we can galvanize youth leadership in adolescent mental health policy. So super duper excited to introduce you, Saanvi, and I'll let you take it from here.
Thank you so much, Sophie. And yeah, go Bears. We did win the game. So Thank you so much for the lovely introduction. It's so great to meet everybody. Hi, I'm Saanvi. I'm a second year at UC Berkeley. I'm studying CS and legal studies and public policy there. And yeah, I work with the Youth Power Project, which is an organization that works on demystifying the policymaking process for youth. We do a lot of work in the health and wellness space, particularly bringing those lived experiences to the forefront of advising this kind of policy. And I guess a fun fact about me that I added on the slide when I was making it was that I'm obsessed with rainbow sprinkles and all things sprinkles. Yesterday, I bought holiday sprinkles and I just like keep them with me. Just like, and when I go get ice cream or something, maybe I'll add my own sprinkles this time. So yeah, I love all things ice cream and rainbow sprinkles. But yeah, next slide, please. Yeah, so a little bit about the Youth Power Project, or YPP for short. Essentially, the organization seeks to demystify the policymaking process, particularly by leveraging direct action, sustained educational programming, and community outreach to bridge the gap between policymaking and youth-led social justice movements, ultimately uplifting young people to transform their lived experiences into law. So a lot of the work that we do essentially is breaking down these barriers between lawmakers and youth by directly centering these stories and voices in policymaking at the local, state, and federal level. So storytelling is at the cornerstone of our work. To us, sharing our stories is oftentimes one of the most direct ways to inform policymakers on where community needs lie, bridge otherwise partisan divides, and ultimately move the needle towards progress where it's so desperately needed. Next slide. So in terms of organizing pillars, our organizing philosophy is very distinct in that it's bipartisan and intergenerational by design, supplementing this experience-based advocacy with long-lasting multi-generational and intercommunity partnerships. This intergenerationality and the development of a framework at such a scale has taught us to really prioritize these 4 pillars. So the first is policy. We work directly on the creation or the development of state, local, and federal policies that particularly impact youth. The second is mobilization and more community-oriented work. So creating that bidirectional feedback loop between policymakers and young people requires actually going into communities and ensuring that those communities are uplifted, those stories that are being shared in those communities are uplifted in these conversations. And that also occurs through engagement. So really working on ensuring that we are looking at reasons why particular groups of young people or young people overall are less likely to be engaged, and trying to tackle those systemic issues in addition to bringing otherwise lived experiences to the forefront of these needs assessments. And finally, looking at education. So really looking to ensure that we are creating resources, peer-based approach to bring more young people into this space by actually doing that demystifying. We work a lot on creating that kind of curriculum that can then be used to bring more young people into this kind of work and advocate for themselves. Next slide, please. Yeah, so I guess a little bit more information on each of these pillars. In terms of direct action, we directly work on writing and informing system-oriented and institutional policy. So we work a lot with lawmakers directly, actually writing that legislation or that policy from scratch, from start to finish, providing peer advocacy and support. One of our biggest things is that we're entirely youth-run and volunteer-based. So we are run by young people under 25, serving young people under 25. And so we really do prioritize that kind of peer advocacy and peer-based support that is so essential to bringing more young people and galvanizing that momentum in a more direct and sustained manner. And this also involves creating long-lasting mechanisms for youth representation in decision-making institutions. And particularly when we're talking about health and wellness, this is so, so important because it's so critical that there are those spaces for young people to be directly informing the care that they're receiving. And this is kind of an example of that. And then in terms of community outreach, really working with local and community-based organizations to foster local discourse and create and cultivate that momentum at the local level to really look at what directly needs to be done in a particular area. At the end of the day, when we're looking at localities that that's where you tend to see like the most pervasive gaps or get the most insight into what needs to be done to fix a specific issue or where those needs are, what even those issues are in the first place. And so that bottoms-up approach is very, very important to us. And we do that through hosting forums with impacted communities and intersecting groups and allies to garner that kind of insight and then uplift that to appropriate decision makers at the appropriate level. And then finally, education, really looking at programs and curriculum that actually, like I mentioned earlier, demystify public policy processes. One of the biggest barriers to youth civic engagement, particularly through the legislature or through public policy, is just that informational asymmetry and like not understanding how to operate or even how these institutions work, let alone advocate for yourself in that sense. So we work a lot in collaboration with partners, with community groups to host teach-ins, to train and cultivate new generations of civically engaged youth. So one of the biggest issue areas that we've looked at, just based on what we've seen as one of the most urgent crises facing young people across the United States, is the adolescent mental health crisis. And we obviously very much prioritize looking at mental health policy holistically. So acknowledging that mental and physical well-being are intertwined, providing both early intervention and crisis response support, understanding the relationship between various factors, including housing, food security, academic outcomes, economic safety, identity, immigration status, and a number of other factors not listed here, and mental well-being, and how nuanced those connections are. And viewing that individualistically it has allowed us to address these attitudinal, economic, social, and familial barriers that we see across the board when we're looking at these more individual experiences, but in the context of trends. And then that helps us, I guess, more systemically address these barriers that a lot of the times we are facing when seeking mental health care. So our strategy really involves like drafting and forming legislation in Congress and state legislatures. So we've worked on resolutions and also legislation, having young people as young as middle school students write the language for these bills that are then appropriating or creating the impetus and urgency for local and state actors to make progress on this topic, and then identifying those urgent youth needs to inform bipartisan priorities in response to this. So creating those local forums and really centering these policies on lived experiences has allowed us to escape sometimes that political dilution that happens when we're talking about health and wellness in like a more political or public policy sense. Also coalescing diverse stakeholders and leveraging those intergenerational partnerships by building coalitions has been so critical to our work. At the end of the day, like healthcare is so complex, and yes, and when we're talking about adolescent mental health care particularly, there are so many additional stakeholders and partners that have vested interests in this space. So working with them has allowed us to actually move the needle on ensuring that, yes, we are centering youth voices, but also at the same time moving collectively towards a strategy that is actually sustainable. And then finally, informing the public narrative by, again, amplifying those lived experiences and voices that, again, are the ones that are living these gaps that we are trying to fix. Yeah, so I wanted to talk particularly about one example from recently about, really turning those stories into law, what that looks like in practice and what that's looked like for us as an organization. Next slide. So for us, like one of the biggest things that we focus on is really understanding institutionally, like where exactly can young people leverage certain institutional processes to their advantage, right? So understanding like the US legislative process, for example, or we also operate state and locally, but understanding more congressionally, like, okay, like this is how systemically like the Senate works or like the House of Representatives works. And this is where like we can tap into like XYZ process. Or what kinds of advocacy tactics can be very successful, or at the same time where we might face the biggest barriers in feeling heard. So looking at, this is just a graphic I put up here about like that we use to like kind of map or look at the legislative process as a whole, but really start to finish, trying to ensure that like young people are at the forefront of drafting that language, and then even in the follow through in the implementation, how exactly can we create that start to finish representation and inclusion of youth voices and those with lived experiences in impacted communities. So for us, one of the biggest initiatives or projects that we worked on this year was introducing a bipartisan set of youth-centered priorities in Congress by way of a bipartisan House resolution. It's House Resolution 434. It declares an adolescent mental health crisis in the United States and sets forth a set of top-level youth-centered priorities to address this crisis within education, criminal justice, healthcare, and more. I guess to provide some context, like I came together with a lot of young people, like my peers particularly, that had similar experiences to my own from across the country, and we put together this consensus based on what we saw as impacted young people. And we did consult a lot with stakeholders. We consulted a lot with other young people from across the country from a litany of different experiences and backgrounds, and then put together what we saw as trends. And sourcing those needs then allowed us to identify where exactly we could operate within creating that urgency for state and local actors to take action to address the crisis overall. So the resolution is completely youth written, and it was introduced by Representative Moulton in May of last year. It's bipartisan, and it sets forth this essential bipartisan consensus on where youth-centered priorities lie in addressing declining adolescent mental health. In terms of identifying these needs, for us, the recognition that, and this was a kind of a jarring recognition for us to make, that adolescent mental health, that this crisis pervades most people's daily lives. When we were talking about our stories or our experiences in this space and what we had faced growing up, or what we were facing even while writing this, to notice that like this is something that every single one of our peers, almost it felt like, was also going through, was incredibly jarring. But at the same time, creating that community, creating that collective, allowed us to identify those trends that could then be potentially mitigated by community changes, by cultural changes, or attitudinal changes, but also policy changes. So creating those safe spaces to discuss lived experiences, it really enabled us to collect that qualitative insight on where needs lie. And at the end of the day, when we're talking about health and wellness, we can look at data points and we can look at qualitative data or quantitative data as much as we want, but these qualitative insights, these stories, are what provide those data points a lot of agency. And that's something that we definitely felt was reflected in this resolution. And when we were talking to lawmakers, was the point we were trying to get across. And it was incredibly helpful. So in terms of writing our own bill, we did it on Zoom and we did it on Google Docs. We had young people from across the country, and we kind of just came together in a series of sessions and really just like channeled, honestly, like the feelings that we were feeling onto a piece of paper. So here's a screenshot of like a Google Doc from like the initial like first draft, and then a screenshot of like a spreadsheet that we had where we were like, oh, these are the representatives that we think would be inclined to hear about this. And then we relied really heavily on like previously introduced resolutions to structure that content, and relied on mentorship and that kind of support available from people who had been engaged in this space in the past, and then worked a lot with stakeholders and committee staff and sought feedback from the partners that we ultimately wanted to bring into this work. And then also acknowledging the importance of grounding our idea in these lived stories and experiences was so essential to our advocacy. Not only did it bring us additional support for the resolution, but also accelerated our ability to impact additional legislation and other local, state, and federal mental health policies across the board. But it was really important to us to develop a strategy that allowed us to speak authentically but strategically based on our audience to actually build that bipartisan support. So storytelling really enabled us to frame the direct action that we were taking within the context of human experiences that are relatable and hard to dilute politically, while also creating this impetus for the greater systemic changes that enable greater youth participation overall in this space. Next slide, please. Like I said before, really our lobbying and advocacy tactics relied around building that diverse intergenerational set of partners, controlling the narrative around this. It's so easy, especially when we're talking about health and wellness. There are so many misconceptions that go around, and we've moved the needle in terms of making this a more open conversation, especially since the pandemic, but it still isn't an open conversation. While it is getting to be a little bit better now and more inclusive, it still isn't, and it's still something that a lot of people are quick to turn their heads away from talking about or try not to talk about. So really controlling the narrative on this issue by pushing op-eds, uplifting stories, framing the resolution from young people across the country. We had some work uplifted in Teen Vogue, and also, wrote a lot of letters to Congress, a lot of stories for local news agencies to bring more young people in communities into this kind of work, sent around floor alerts that consistently uplifted the message that we were trying to convey. So really also advocating to stay centered in the conversation around this resolution was so important to us. And finally, looking ahead, looking just to provide a status update, the resolution has around 26 bipartisan co-sponsors. We've engaged with over 300 legislative offices and have had over 150 direct meetings with legislators and impacted youth. And we've engaged with over 50 stakeholders and over 36 young advocates across the country, and are continuing to bring more individuals and partners to our work. Even just from the introduction of this resolution, we've been able to work on an additional, I think almost 10 additional policies, some of which were policies that were already being informed or already being implemented by various federal agencies or congressional leaders, but also bringing more young people into actually writing these policies and making some of these recommendations that the resolution provides tangible or a potential reality. So that has been really, really rewarding, and we're really, really excited and thrilled to see this kind of progress in this space so far. Thank you so much. I'm so happy and so excited to be here with you all and to provide this framing on some of the work that we've been doing. We'd love just to stay connected, and here's some information about me and then the website. for our organization. But it was so great to share this with you all. And again, always open to hearing from you if you have any stories or experiences that you'd like to uplift or collaborate with us on. But yeah, thank you so much for your time, and it's great to meet everyone.
Thank you so much, Saanvi, for that. We'll have some more time for additional questions and comments and discussion after the roundtable. But I just want to reemphasize how important this work is. So many young people have been systemically excluded from having access to the language around policy that, like I said earlier, affects us in our day-to-day lives. And it's such a vicious cycle where young people have this drive for change, but aren't able to access those institutions and access those systems. And work like yours is really changing that narrative and giving young people direct access to that language, breaking down these barriers. And I'm just so inspired by you and your work every single day. So I'm super excited to kind of transition this over to the roundtable so we can kind of discuss a little bit more about this topic. Today we have Candy Chen, who works within the federal policy space. We have Leo Corso Clark, who also works in state policy. And we have Alex Edgar, who works on California higher education. So I'm super excited to kick off this discussion and then transition it over to questions.
Thank you so much, Sophie. I'd love to introduce some of the panelists on this roundtable. First, Katie. Katie is a second-year undergrad at Columbia. She became involved in education advocacy in high school, working to uplift youth voices into conversations on education policy decisions in the state of California, and then became increasingly involved in mental health and reproductive justice advocacy spaces. She also works with the Youth Power Project and is committed to the development of sustainable, effective, and accessible mental health support systems. She has worked on the House resolution that I just talked about, but also on federal policies expanding access to novel peer-to-peer behavioral health programs within the context of education. So thank you so much, Katie, for being with us. I'd also love to introduce Leo. Leo is originally from Berkeley, California, and got his start in mental health activism in Albany Unified School District, where he served on the school board as a student trustee, using his position to successfully advocate for increased mental health supports during the COVID-19 pandemic. Leo has worked with several nonprofits and advocacy groups to advance student mental health advocacy, and is a junior at Brown University studying public policy, education studies, and music, and is doing a semester right now in Washington, D.C., working for the federal government. And finally, Alex Edgar is a 20-year-old senior at UC Berkeley, where he serves as the External Affairs Vice President for their student government. In this role, he's done a lot of extensive work to push the university to expand its mental health and crisis response services, and has worked with labor unions to advocate for an increased number and better support for mental health personnel on campus. Through his varied advocacy work, Alex shares his personal mental health struggles to try to normalize open conversations about mental health in the activism space. So thank you so much, Alex and Leah, also for joining us. And it's so great to have the three of them here as youth advocates, but also as youth advocates that carry very diverse experiences in both state, federal, and system-wide policy changes. So thank you all so much for coming. Yeah, so to kick off this discussion, we have a few questions that we wanted to ask you all sort of about your experiences as youth advocates and what sort of brought you into this space. So to kind of open that conversation, what motivates you to advocate within the youth mental health space, and what has your advocacy entailed? Feel free to share any lived experiences or personal observations, whatever you're comfortable with, that brought you to this field and may contextualize your experiences as a young advocate. And Leo, if you want to go first for this question.
Yeah, thanks so much for that introduction, Saanvi. And thank you to everyone for coming here. So like Saanvi already mentioned, I got started with my advocacy era in high school, working on the school board, and it was a very interesting time. I was appointed, right after school shut down in March of 2020. And my school had been known for having a lot of mental health issues around the students, but it wasn't really on the radar of any adults in our district until, of course, distance learning, and the COVID-19 pandemic showed how isolated students really were. And I think that, working with folks like Katie and Saanvi in an organization called Generation Up in California, we saw a really great opportunity to use the new attention that mental health had to really pioneer a bunch of really important legislative accomplishments. So one of those big things was mental health days in California, which would essentially change the attendance code to make it so that students could skip school the same way they would if they had a cold or a fever, to take a mental health day off. And that was some of that I experienced in high school of just like reaching burnout, feeling the struggle to get out of bed, especially in the pandemic, which is a universal feeling among students. I think everyone's had those days. And for the longest time, it was just brushed off as, oh, you're lazy. Of course, you don't want to go to school. No kid wants to go to school. But students know it for what it is, which is a real mental health issue and a mental health crisis. And so being able to capitalize on the new attention that the pandemic brought to student mental health really catapulted me and other students into mental health advocacy, which I think is a silver lining of the pandemic as a whole.
Definitely. Katie, do you want to go next?
Of course. Thank you so much, Saanvi, for that amazing introduction, and really grateful to be in this space here today. Just kind of really building upon what Leo said, I think for me, as well as for many of you guys who are here, I grew up in a community where mental health was very much ignored or tried. No one really dared to voice like their mental health struggles, just because of being labeled as like an excuse for not wanting to do work. You're called lazy, you're called weak. And it just over time became easier to pretend like everything was all right. And so I just kind of pushed your mental health to the side until like you reached a breaking point, so you couldn't anymore. Like Leo mentioned, I started in this advocacy space through education advocacy in high school. And I think it was through this advocacy where I met this really fantastic group of students, and we were working on these mental health bills that were addressing kind of the loneliness, the like the stress, the anxiety that students were feeling during the pandemic, and then it was like kind of like dissonance I was feeling, where I was working in this mental health space during the day, but then at the end of the day, coming back to the community, I didn't really acknowledge the validity of these mental health struggles. And it was kind of like irony that made me realize that something needed to change, sort of in how our community talked about mental health. In particular, some of my experiences navigating my mental health in high school and in college made it very clear how like little institutional support there is in place for students who are struggling. I remember trying to schedule a counseling appointment last semester, and it was just like a weeks long waiting list to even like get an appointment, and it just became very clear to me that there weren't enough resources out there for students. And I think just talking with a lot of peers, as well as with students across California, New York, and the country, that really helped me realize sort of two things. Number one, just how common these mental health struggles were, but also how much this mindset of just ignore it until you can really shape the ways that schools, health systems, and other institutions dealt with mental health. Having these conversations is also really powerful because it became very clear that there's this incredible network of passionate youth across the country who have been deeply affected by these institutions and who want to help. But in a lot of situations, they felt like they didn't know how or didn't have like the avenues to make an impact. So I think a large part of my advocacy has been reaching out to these youth, making them center their stories. Like Saanvi talked about, like the power of storytelling and really making sure that our experiences are affecting the policies that are being made.
Thank you so much for sharing, Katie. And Alex.
Definitely. Well, I want to start off by thanking y'all for having me and thanking Saanvi for bringing us all together. But yeah, no, I think for me, what motivated me to get involved in the youth mental health advocacy space was, experiencing so much of my own struggles, and I definitely relate to what both of them just shared about kind of just like feeling like there wasn't that many options out there, and growing up in a very conservative hometown where that just wasn't a conversation that you could have, and it often was something that you talk with your peers, and people would be experiencing similar things, but no one was comfortable to talk to their parents about it because they were afraid of how they might respond, or they weren't comfortable talking to the school because they think that they're going to be dismissed as being emotional, that you're just in high school. What is this you're feeling? So I think for me, I've tried leading a lot in my own community and working to uplift as many voices as possible to ensure that we are normalizing these conversations within our own spaces. And I think in particular, one thing that I have really tried working on over the past couple of years in college has been, making sure that as youth advocates, both within the youth mental health advocacy space, but also just advocacy as a whole, we are really focusing on uplifting the way that putting ourselves on the line through advocacy can have negative impacts on our own mental health, and making sure that we are taking care of ourselves, and we are taking care of the people that we work with, and those that work for us, to ensure that we are reducing burnout. We are making sure that students in particular, young people in particular, people who are most impacted by the ongoing mental health crisis, are being able to advocate for themselves, but are also not losing themselves by doing this advocacy work. And I think that's what has kind of brought me into the space, is to ensure that we're really centering that in these conversations that we're having, in particular when we're talking to legislators who might not have a full understanding of what it's been like to be a young person with everything that's been going on in the world, from the pandemic and everything else. So definitely, I'll try to bring that into the space.
Thank you so much to all of you. I think just for sharing both your personal experiences and your observations, and really highlighting the crux of what care has and hasn't looked like for you in a number of different contexts. And I think what you all have said is, I mean, at least for me, has been super incredibly relatable, something that I think it just speaks to how pervasive of an issue this is, and just bringing voice to that is so grounding as well. So I know we talked a little bit about this earlier, and we've sort of been talking throughout this conversation about what we see, or I guess touching upon what we see as priorities in addressing the adolescent mental health crisis and gaps that we are seeing that have affected our communities. And I really appreciate also, Alex, you mentioning that component about self-care. Even as an advocate, sometimes that dissonance, not being able to care for yourself, even in your advocacy about care, it's such an interesting place to be. And as Katie mentioned, also that irony that persists beyond just that context as well. I guess just to wrap it up really quickly, how do you all think that adults and allies, and maybe keep this a little bit more brief, but how do you think adults and allies can create a more inclusive space for youth voice and social justice spaces, specifically pertaining to youth health and wellness? And what do you think that looks like?
I guess I can go first. Yeah, I think a huge thing for me is just access. I think that there are definitely a lot of adult allies that I've encountered throughout my advocacy journey who are really committed to uplifting student voice. But at the same time, there are so many students who are not go-getters, are not public speakers, do not want to go and speak in front of a large crowd or on a Zoom webinar of 200 people, but who still have really important issues that affect their day-to-day lives in regards to mental health, and still have opinions that are worth hearing and worth sharing. And when I was a student, that was something that I really tried to uplift, not just by using my own individual voice to represent the entire student body, but bringing students' voices directly to the board. And that's something that I've continued to try to do throughout my advocacy effort, whether it's in Providence, Rhode Island, where I now go to college, or whether it's just in my day-to-day life on campus, of uplifting people who are not interested in being advocates, but who still deserve to have their voices heard and represented. And so that's something that I really implore adults to do, is not just seek out the go-getters, the Saanvis, the Katies, the Alexes of advocacy spaces, but seek out the students who are not ever going to raise their voice, but are really happy to answer questions when asked.
I like 100% agree with that, Leo, and I'm so thankful that you're kind of actually doing that work. I think for me as well, it's like definitely more of a shy person. I think it took a lot of time for me to be willing to like speak in these spaces. So I'm really grateful that people like you are out here kind of reaching out to people who have such important things to share that might not be considered. So I think something else that I've been thinking a lot about, especially due to my work here at YPP, is the importance of sustainable or for intentionally creating these like sustainable avenues for youth engagement. I think a lot of the time we talk about storytelling, centering youth stories. There's this idea of, okay, let's host like a roundtable, let's host a forum, let's collect some of these stories, use that to inform policy. But then there's no space for youth to continue to remain involved. And I think one thing that I appreciate so much about YPP is how it teaches youth like sort of what comes next in that policy making process. It teaches youth to write their own bills, to actually engage in the pitching process, to work on advocating for the bills, getting in meetings with legislatures, and then following through to implementation. And I think this sort of education of having allies who are willing to teach youth these skills is just so incredibly important, because it just builds the foundation for work like into the future, and it really empowers them with feeling like they can actually make a difference. Yeah.
Like 100% what both of them just said. I think the biggest thing for me is kind of how we can ensure that we are elevating the voices of young people without tokenizing and minimizing them as youth advocates, and solely emphasizing their youth identity, but also making sure that we are really, really, really valuing them for the experience that they're bringing into the space. So that means, instead of just having an advisory board with, one student on it, like how can we ensure that like that student A is actually engaging in tangible work in the space, and is not just there to, kind of check off the box of having a young person here. So I think really intentional youth engagement at all levels of decision making, from coming up with project ideas, bill ideas, to actually implementing them, having youth perspectives, especially amongst diverse youth, from geographic diversity as well, which is I think one thing we don't talk about as much is rural and non-college student mental health. I think that is increasingly important and not that often talked about. So just in general, engagement that is intentional.
All right, thank you so much, Katie, Alex, and Leo, for coming out and sharing your experiences and providing such needed insight on youth representation and engagement and voice in this space. I'm just so grateful to be able to work with you all. And everyone, Katie, Alex, and Leo are absolute go-getters and just incredible advocates and friends and people to be around and share this space with. So I'm so deeply appreciative of their time this morning. And thanks again so much for sharing your perspectives. But yeah, I think I'll pass it now back to Sophie.
Thank you so much, Saanvi. I really, really appreciate this panel. It's so wonderful to see young people really working towards, like I said earlier, closing this gap and really making sure that no young voice gets left behind. We are kind of short on time, so I'm going to go ahead and call up our SAMHSA update. We're going to hear a little bit from Dr. Richard McKean. So please go ahead and give us your update.
Thank you, Sophie. I will be quick. I wanted to let people know that SAMHSA has released some additional media resources around crisis care and suicide prevention. Specifically, there are 2 separate social media videos, one on suicide warning signs for adults and the other on suicide warning signs for youth. These are historically the old versions of the suicide warning signs was actually the most frequently requested material from the SAMHSA store. Also, a safety planning video, which this video walks people through the steps of creating a safety plan. So this is another really useful resource. Additionally, wanted to let folks know that next week, Vibrant and SAMHSA are hosting a mobile crisis meeting, and I should specify the meeting is focused on the interface between 988 call centers and mobile crisis, because that link is a critical one. And then finally, I'm so glad we mentioned that 988 has been launched in Canada, which is great. I had the pleasure a couple of weeks ago of doing a webinar on 988 in the US and Canada, along with Canadian colleagues. This was part of the International Association for Suicide Prevention's Partnership for Life effort in the Americas, which is important to bring people's attention to. And then finally, SAMHSA had a meeting earlier today with the leadership of what until today was called the International Initiative for Mental Health Leadership, which is a very valuable international exchange. It is now called the Global Leadership Exchange. And there's been a lot of work and is upcoming work on suicide prevention and crisis care as part of the 2024 leadership exchanges, including on crisis care, a crisis summit, which will be at the end of, right after the main meetings in the Netherlands. So I will stop there and pass it back.
Thank you so much, Dr. McKean. Really appreciate that update. And I'm going to pass it over to Nashbid to talk a little bit about 988 implementation and access for marginalized communities. And we're going to hear from Dr. Brian Sims.
Yes, and thank you, Sophie. And very quickly, as you see on the screen, we are just acknowledging that there are a number of states that have participated in 988, and all of the darkened areas. We are still working on 18 others that we would like to see join in. But very quickly, in our quarterly discussions that we have with states and jurisdictions, we continue to receive reports of areas or communities that are unaware or poorly informed regarding 988. This has led to issues of lack of access to very much needed services. These communities have high prevalence of crises and historically low access to services. We applaud the efforts that have been seen by many states to address this vitally important endeavor. Now, recognizing that every community is unique, approaches have acknowledged this important factor. Utilizing SAMHSA's 6 principles that guide a trauma-informed approach, many states have adopted strategies to connect, collaborate, and hence empower communities in an effort to foster trust from within and reduce or eliminate stigma. Some of the efforts have centered around empowering the faith-based units, also barbershops, beauty salons, and they all take on a message of 988 to the communities to be heard within the communities, which are then more trusting environments. Now, as we move towards and forward in 988, we thank the efforts and encourage anyone with questions or other initiatives to please contact us here at NASBID, and we'll be happy to connect or share any initiatives that they have. And Sophie, thank you so much for what you're doing, and I'll turn it back to you.
Thank you. Super exciting updates. All right, I think we're going to go ahead and move on. Perfect. So now we're going to have a little quick crisis talk discussion about philanthropic foundations and how it is working to decriminalize mental health. So super excited to call up Melissa Beck, who will be talking with Stephanie Boris Hepburn.
Thank you, Sophie. So I'd like to introduce Melissa Beck. She's the Executive Director of the Sozozai Foundation. Melissa, we'll be brief here, but when we spoke, you highlighted that the Sozozai Foundation uses both traditional and non-traditional philanthropic approaches. Can you explain briefly to viewers what that means and why you use a mix of both?
Yeah, absolutely. Hi, Stephanie, and hello, everyone. It's so nice to be here at the Crisis Jam. It's been a minute for me, so it's nice to be back, and so impressed on everything that occurred today and certainly in the past several months. The Sozozai Foundation really has been working hard to support the implementation of 988 and the build out of the crisis care continuum. We try to do so both through grant making, and again, it's really grant making to catalyze new promising practices, work in spaces where government funding isn't available, or where thornier issues might be emerging, or other ideas that perhaps haven't risen to the popular point, are being percolated. Sorry, that was a lot of P's. We're also, in addition to being grant makers, we are also conveners. I know a number of you, just from going through participants, have been at our SOZO-SAY Summit to decriminalize mental illness. That's a big tent event, and we have been focusing on 988 during the past 2 summits. This year, the summit is April 16 and 17, 2024 in Philadelphia. We've made the difficult decision not to live stream the event. So if you're interested, keep your eye peeled for registration. We will be recording it, but again, just simply not live streaming. We've decided, Stephanie, to pull the 988 conversation actually out of the in-person event. And we're going to be kicking off a series of what we call SOZO-SAY Summit Solution Labs, which are virtual meetings. And 988 will be a theme across 2024. And the kickoff will be on March 1st. And again, that's a virtual event available to all. You know, as funders, in addition to grant making and convenings, we also work hard on our communications, which is part of why, Stephanie, we were so excited to speak with you, and thank you for highlighting our efforts. It is definitely a team effort involving both the foundation, but really most of all our grantee partners and other friends across the field. But communications is really key. And for us as the SOZO-SAY Foundation, our work is all focused on eliminating the inappropriate use of jails and prisons for the diagnosis and treatment of mental illness. Communications is a big part of that, so that we can work to reject that status quo. So follow us on social media, read Stephanie's amazing article, A+, Stephanie, and we also have a second season of our podcast that just dropped on Monday called Call Declined, which you can find anywhere you get your podcasts. Again, thank you all for your amazing work, making the world a better place. It's again an honor to be here.
Thanks, Melissa. I'll pass it back to you, Sophie.
Thank you so much. All right, we're going to have to wrap up real soon, but this is just us looking ahead to our next Crisis Jam session for debate number 2, which will take place on January 24th. The director of the Phoenix Police Department, or detective within the Phoenix Police Department, Sabrina Taylor, will be debating Dr. Jen Struber about whether or not crisis care should come in a police car. And this marks our 10 o'clock hour, 1 p.m. on the East Coast. Thank you so much, everyone, for stopping by this session of Crisis Jam. This was such an incredible conversation. We covered everything from, redesigning systems that need to be abolished and unjustly harm marginalized populations, to giving access to youth and young people in the policymaking process. Just some very, very important topics today. It's been such an honor to host, and thank you so much, everybody, for watching and for allowing me to share space with you guys and be part of such an incredible community.